This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Fluids and Electrolytes, Part 2.
Now let's talk about sodium. Remember, with sodium changes, we will see neuro changes. What kind of neuro changes will we see? Look for personality changes, confusion, headache, lethargy, agitation are some of the neuro changes you may notice in your client. Let's talk about lithium. What is the normal value for lithium? Right, 0.6 to 1.2. And this is the same as creatinine. So write that down and keep those numbers together. Now, what kind of client usually gets lithium? Right, bipolar patients. When you have a patient on lithium, which electrolyte imbalance should you be worried about? Yes, sodium. Remember, hyponatremia can precipitate lithium toxicity. I repeat, hyponatremia can precipitate lithium toxicity. And lithium toxicity can cause coma and cardiovascular collapse. Once again, hyponatremia can precipitate lithium toxicity, and lithium toxicity can cause coma and cardiovascular collapse. What foods are high in sodium? Well, canned foods, bacon, frankfurters, ketchup, lunch meat, soy sauce, mustard, processed foods, pickles, gravy, pizza, and of course, plain old table salt. What is the normal value of sodium? Right, 135 to 145 milliequivalents per liter. What are the signs and symptoms of a client whose sodium is high? Well, here's an easy way to remember. Anytime you think of hypernatremia, think dehydration. I repeat, anytime you think of hypernatremia, think dehydration. Now it's so much easier. What are the signs and symptoms of a dehydrated client? Extreme thirst. Why? Well, because they're dehydrated. Fever. Decreased urinary output because they are dehydrated. Dry and flushed skin. A dry, sticky tongue. Dry mucous membranes. There'll be neuro changes, agitation, confusion, and seizures. Hypernatremia could be caused by renal failure, increased water loss, increased rate of metabolism, or even a fever. Okay, we know this is a fluid volume problem, so how do we treat it? Anytime we have a fluid volume problem, we know we are going to weigh the client. How often? Yes, we weigh them daily. At the same time. Same clothes. Same scale. Also, IV infusions may be given, diuretics may be given, and sodium is restricted. What about hyponatremia? Think fluid overload. I repeat, for hyponatremia, think fluid overload. That makes it super easy to choose the answers related to hyponatremia. So what are the signs and symptoms? Pulse? Well, yes, we would have a pulse, and it would probably be a rapid bounding pulse. What do you think is going to happen to the urine output? Increase or decrease? Increase, because the fluid volume is high. Respirations. Shallow and ineffective, because the client is in fluid overload. When you auscultate, what will you hear? Probably crackles. Treatment for hyponatremia can include osmotic diuretics like mannitol. Let's take a look at another important electrolyte, calcium. When you think of calcium, I want you to think calmative. Calcium keeps us calm. Calmative is another word for sedative, sedation, and we're going to talk about this a bit more in the next slides. Can you name some foods that are high in calcium? Milk, yogurt, cheese, leafy green vegetables, seafood, and legumes. In the previous slide, we talked about how calcium acts like a calmative, and we said calmative was another name for... Yes, calmative is another name for sedative. Calcium acts like a calmative. This means calcium acts like a sedative. When our calcium level is right, we are nice and calm. When it's too high or too low, that's when we have problems. So here's an easy way to remember the signs and symptoms of calcium. When your calcium level is high, this means you have too much. Too much what? Sedative. Yes, you have too much sedative. So what are the symptoms we might see? Well, everything in the patient will go up or down. Too much sedative, down. That's right. When you are over-sedated, everything will go down. Symptoms we will see may include heart rate, up or down. Down, yes, bradycardic. Skeletal muscles, up or down. Down, yes, profound skeletal muscle weakness. We need to worry about the respiratory system here. Deep tendon reflexes, what do you think? Diminished or present? Yes, they would probably even be absent or diminished. What about bowel movement? Too much calcium? Probably constipated. Bowel sounds? Probably hypoactive. Now, what's the treatment for calcemia? Well, if medication doesn't work, dialysis may be needed. Remember, calcium has an inverse relationship with phosphorus. This means when calcium is high, we can give phosphorus. What will phosphorus do? Well, lower the calcium. Calcitonin can also be given. Did you know calcitonin is also made by an organ in our body? Which organ in our body secretes calcitonin? Not the parathyroids. Try again. Right, the thyroid glands. The thyroid glands secrete T3, T4, and calcitonin. Remember, calcitonin tones calcium. Why is vitamin D discontinued? Because vitamin D helps with the absorption of calcium. We already have too much, so we discontinue our vitamin D. Now let's talk about hypocalcemia. So when your calcium level is low, this means you have too little sedative, right? And with too little sedative, are you going to be calm? No. So what do we see? We see muscles that are twitching. Everything in your body is kind of agitated. We will probably see diarrhea, a positive Schvotek sign, and a positive Trousseau sign. We'll discuss the Schvotek sign and positive Trousseau sign in more detail. Here are two classic signs of hypocalcemia, a positive Schvotek sign and a positive Trousseau sign. A Schvotek sign is when there is a contraction of the facial muscle when you lightly tap the facial nerve in front of the ear. Next time you are in clinicals, check your patient's labs. I want you to look for a patient with really low calcium, then try it. You won't forget it. It's very interesting. Let's say it is the same client with a low calcium level. With Trousseau sign, all we do is inflate the blood pressure cuff. Let's say your client's systolic normally runs about 130. Inflate the cuff to about 150, 20 over the client's norm. Hold it there for about 3 to 5 minutes, and guess what? Yes, you're going to see spasms of that arm. Remember to always keep your patient safe, so if you're not sure, ask an experienced nurse to show you. Remember, you are more than a conqueror, and you will be successful. Join me as we review core content in the next unit.